Hi, everyone. Thank you so much for inviting me to join you all for this discussion today. I'm Amruta Nori-Sarma. I'm an assistant professor in the Department of Environmental Health over on the medical campus at the School of Public Health. And I'm going to be talking about some of the work that I do focused on climate change and the intersection with Africa. I also have to admit that I don't do a lot of research myself in the African continent. I have some experience with research projects that are ongoing there, but primarily I view my role in this area as one of capacity building. I think that I have some expertise on epidemiologic analyses and data sets that are required, information that's required in order to facilitate research looking at this intersection of climate change and health. But I don't necessarily think that I need to be the one who's doing the research. I would like to be the one who's helping to facilitate the research. So I'm going to be talking a little bit about my efforts in that vein. Maybe it's this one. Oh, okay. One of the things that I want to highlight at the beginning is that when we think about climate change, we have this idea of a systemic set of events that might be happening at some point in the future or long-term changes that are happening slowly over the course of time. And what I've started to think about in terms of climate change impacts on human health is that, yes, this systemic change is leading to adverse health outcomes in the long term, but in the short term, there are a lot of immediate impacts that climate-related extreme weather events are having on human health today. And so a lot of the research that I do in the environmental health program is focusing on what are the acute extreme weather events that are occurring right now, already at present, that are associated with ongoing climate change, and what are the ways in which those acute events are having impacts on a variety of different health endpoints. And actually, knowing the amount of time that I have, I'm going to skip ahead a little bit first to talk about the capacity building component that I mentioned earlier. So alongside Greg Wallenius, who is the director of the BUSPH Center for Climate and Health, as well as my colleague, Dr. Francesca Dominici, who's the co-director of the Harvard Data Science Initiative at Harvard School of Public Health, I'm one of the 3 leads of the new Research Coordinating Center that's funded by the NIH for their climate change and health initiative. So our CAFE program, as we call it, seeks to convene, accelerate, foster, and expand the community of practice at the intersection of climate and health. You can get more information at our website that's available there. We have around 2,000 people who have signed up for our initiative, who participate in our annual meeting event, who are talking about research across different stakeholders, including academic, but also non-academic stakeholders. A little under 10%, I think around 9% of the folks in our community of practice are practitioners on the African continent. We also just closed our first pilot funding mechanism, which is going to provide funding and other resources for research projects on climate change and health. Close to 25% of our applications came from researchers in Africa. So we're really excited to see what work comes out of that. And a couple of projects that I've been working on as an advisor. This is one project that's led by a researcher at the Stellenbosch University in South Africa, which is looking at climate change and mental health presentations in claims data that they have available across the Western Cape region in South Africa. They're interested particularly in the mental health impacts of drought and flooding events across South Africa. Another example looking at drought in Kenya is a project that's led by a researcher who's a clinical psychologist who is interested in sustainable rainwater harvesting and the potential for community building and changes in adverse mental health outcomes among women who are looking at alternative methods for providing access to clean drinking water and sanitation facilities in different communities. So I'm really excited to share any information about CAFE. I see a couple of other people who work with me on CAFE who are in the audience. So would love to talk with you more about this or any of the other resources that we're providing through CAFE over drinks later.